shipping, or you can go in and help us obtain addresses just from anysoldier.com. So you can participate in many different ways. Also, tomorrow is Random Acts of Kindness Day. So I had a challenge out that I put out last week for y'all to go out and find some way to be kind to somebody and share that. It doesn't, there again, it doesn't have to cost anything. It can, you can open a door for somebody, give them a parking spot, let them cut in line, buy them a cup of coffee, pay for the person in line at the drive-through behind you, you know, share a book. There's all different kinds of ideas. I did share a list, just a brief list, just to kind of generate. So be creative, think of something, and let's share the kindness, like we just saw in the video, and you know, make the world as one. Let's see. So the 26th, we have Infinite Possibilities coming up again, and Embracing Our Differences. That's at 1 o'clock. I know a lot of people are having a hard time with that time frame, but they do record them and post them after, so you can always go back in and watch them after the fact. So if you're going to watch that, go ahead and join that. You can find it on the calendar in DACDB. Let's see, I got a message from Esther. Matt Horton's Celebration of Life will be held at the Inglewood United Methodist Church on Saturday, March 6th at 11 a.m. They are going to be doing masks are required, social distancing, and there will be no gathering afterwards. I think they just wanted to go ahead and get this taken care of and move forward. So anybody is welcome to attend. She is understanding if you are not comfortable with attending. But, you know, if you are, you know, give her good wishes. Kind of a sad thing. Yes.
On that note, if anybody comes across a condo that could be rented, very close family or a friend of theirs contacted me the other day trying to get a condo lined up.
Okay.
That because they're coming down to it.
Okay.
Let me know. I'll get you.
Okay. So if anybody knows of any condo rentals during that time frame, please contact Tony.
It's a tough time frame too.
Yeah,
It
it
is.
is.
That's
It
what I
is.
told him. I told him, you know, just reach out to anybody and everybody.
Yeah.
Because
Exactly. Exactly. Well, and I would have had mine, but now I'm moving back into it. All right, so, and then we have the Fine Arts Festival, save the date. We are not across the finish line yet, but we are getting closer. As Carol gave you all an update last week.
All
You know,
we
it's,
need now is the permit from the health department. They want to make sure that we've got additional washing station. And so we're doing that. That's really, yeah, we got
The last one.
the banner permit. So
Perfect.
that's ready to go. And the banner is now on my deck being cleaned.
So what across Dearborn you're talking about?
Yeah, one that goes across Dearborn. We aren't going to be spending extra money on things like signage. And so any place where we could get donations, masks, donations, gloves, donations of hand sanitizer, it would be great. So if anybody knows the sources where we could maybe get those, and we would certainly advertise whoever did the donations. But any place we could save money would be great.
absolutely. Yeah, I mean, our revenue is gonna be down, but at least we're gonna have some revenue. You know, so anything that we can get donated is much appreciated. I don't know if all of you on Zoom could hear that, but we are looking for donations of sanitizer, gloves, and masks. And are happy to advertise in return. So if you do happen to know of anybody, let us know. We're going to try to reach out to Englewood Hospital and a couple others and see what we can obtain. But yeah, please spread that around and see what we come up with.
Red gloves and
We don't want this.
volunteers or
For anybody.
Yeah.
We're encouraging, we cannot require them, in Sarasota County, because they are not required in terms of you can encourage and request masks, and we will have all that signage. Our volunteers should all have masks on, our artists should all have masks on. But we cannot do anything with the general public. If they don't have a mask when they come in and they want one, it would be wonderful.
Have you checked with the county? Well, I guess that would be Charlotte County. I was gonna say, or their emergency disaster, they're doing some stuff. I think they're the ones that are providing them at the airports and whatnot.
I asked Dr. Chase, not Chase, and Lydia. He's a Rotary, and see if there's something that they might
Well,
have available.
Dr. Nadler as well.
Oh, yeah.
I don't know how much they're getting as far as extras, but
Right. But Millennium might, yeah.
yeah.
I'll send it
I'd
to
say
Todd.
might be better.
Okay. Well, thank you, everybody. So you have all those dates for the upcoming on your calendars. So without further ado, I will go ahead and introduce our speaker for today, Steve Agius. Steve became a Rotarian in District 7260 in Suffolk County, New York in 1983, and served as a chairman of the Rotary Gift of Life in that district until moving to Florida in 1996. He is a member of the Bonita Naples Rotary Club and serves District 6960 as chairman of the Gift of Life of Florida and the chairman of the Wheelchair Committee, which many of you have heard Steve speak with us before on wheelchairs. And he is an instructor with the Rotary Leadership Institute. Steve is a major donor to the Rotary Foundation and a member of the Paul Harris Society, the Bequest Society, and is honored to be named District 6960 Rotarian of the Year in 2011. He is the managing partner of Creative Tile and Hardwood Floors in Naples. Welcome, Steve.
Thank you. Cool, appreciate it. And hello, everybody on Zoom. I wanted to say that typically between the Wheelchair Foundation and Gift of Life, I do between 30 and 35 speaking engagements during the course of a year. The past year, I've done one. So when the opportunity came and your president so graciously invited me to be here in person, there was no way I was going to say no. So here I am. So anyway, it's going to be my pleasure to tell you about Gift of Life. Like all great Rotary programs, Gift of Life was started by an idea by one Rotarian. It was a Rotarian from the Manhasset Rotary Club out in Long Island, where I'm from originally. And he was in Uganda visiting a water project that his club had been involved with for a number of years. And a Rotarian over there said to him, we have a friend of a friend who's got a young daughter who needs open heart surgery. And in Uganda, this is 1975 now, in Uganda at that time, there was not a single facility that could provide open heart surgery for a child. So the guy had an idea. They had members in their club who were affiliated with St. Francis Hospital in Roslyn, Long Island, which is a renowned heart surgery facility. He said, you know what? I'm going to go back to my club. What if we brought this child over here, had her stay with some Rotarians for a while, get her into the hospital, get the surgery, and send her back home? So that's exactly what they did, and it worked. So that was child number one, 1975. Like all good Rotary programs, it soon was being stolen by every other Rotary club you can think of. So all clubs everywhere had heard about this. They were starting to do it. The Manhasset Club was continuing to do it. And that's how I got involved in Suffolk County on Long Island. So part of the mission of Gift of Life was not only to save children by bringing them to wherever your club was with a relationship with a hospital, provide the open heart surgery and send them home, but the other part of it was to train and equip the countries where they were sending these children from and get their pediatric cardiology units up to speed and to a point where they could do their own surgeries. And we kind of neglected that first part at the beginning because every other Rotary district or club from around the world, there were about 45 Gift of Lives at that time in the, let's say, after 75 into the 80s, 90s. The need was so great, and they were sending these kids, and we had great arrangements with hospitals. Here in District 6960, a bunch of us from Long Island started one in the late 90s. We said, we can do this Gift of Life thing down here. We got All Children's Hospital in Tampa, St. Joe's Hospital, and Joe DiMaggio Hospital in Hollywood, Florida, to all agree to take kids if we would bring them in. So in the late 90s, early 2000s, our district was bringing in between 15 and 18 children. We'd pick them up at the airport. They typically would come with one parent or a guardian, and the stay would be 2 to 3 weeks. As time's gone on, the stays have become shorter and shorter. These kids, a day or two after surgery, they're jumping around and running all over the hospital. It was really an amazing program. And we got a lot of Rotarians in this district really involved in this program. And so many of them would tell me later on when you'd ask, you know, that was when I realized what it was to be a Rotarian. That was the highlight of my Rotary career. You know, having these kids and the parents stay with you and be with them through this traumatic time and hold their hand, get them through it, have a successful heart surgery, and get the child to go back home. I mean, it's just a great story and it's a great program. In 2008, as the Great Recession was coming upon us, our entire world changed. In our district, the 3 hospitals that we were doing business with said, we can't do this anymore. They were charging us $5,000 a child, which was pretty much the going rate everywhere in the world. And we said, oh boy, what are we going to do now? Because, you know, again, our district was so engaged, and there were plenty of other districts facing the same dilemma. All of these hospitals now just could not afford to keep subsidizing these surgeries, which were running $75,000 to $150,000, and we were giving $5,000. They just couldn't do it. But coincidentally, in 2008, right about the same time that this was happening to us, about a year or so prior, some of the originators of the program up in Long Island took a look at the 45 or 50 Gift of Life programs all around the world. And he said, you know, this is great. We're doing a lot of kids, we're doing a lot of great stuff in the world. But what if we put together an umbrella organization to coordinate all of the things that these disparate clubs and districts are doing? Let's get them all together, working together. We'll bet you we could be more efficient. They hired a young man who you're going to see shortly on a video I'm going to play by the name of Rob Railman to be the, I think he's called the CEO of the program. And at the same time, we had been starting, because like a district as ours, for example, we were raising more money through clubs like yours than we could spend on the surgeries. So we started doing things like sponsoring cardio surgeons that we knew to go on medical missions in different countries. And we pay $30,000, $40,000, $50,000 to send a whole team over for a week, go into the country and get back to that original mission statement that we had. Let's start training in the countries where they're sending us these kids. And so we started to do all that together. And then we all got involved in this new organization called Gift of Life International. So I'm going to ask if we could start that video now, and it'll do a much better job in less than 10 minutes of telling you how the program has changed since we went into this direction. And I think you'll find it pretty interesting.
When a child is born with heart defect, it's really a difficult time for them.
These babies don't feed well.
Most times they're very sick,
They don't grow well.
tired most of the time,
Shortness of breath, difficulty breastfeeding.
cannot play with other children their age. So they tend to be isolated and feeling so disadvantaged. I know this because I was that child. My name is Grace Aguero, and I'm the very first child to receive heart surgery with Gift of Life. I was 5 years then.
Since that day, Gift of Life has helped over 30,000 children from 79 countries, spanning over 5 continents. I am Rob Railman, the CEO of Gift of Life International, and we are a nonprofit organization with our mission to develop sustainable pediatric cardiac programs and to empower doctors and nurses in their own countries to take care of their own children. Congenital heart defects are the #1 birth defect in the world. 1 out of every 100 births, there's a child who is born with a congenital heart defect. And 93% of those children are born in a country that can do nothing to treat them. We focus on helping children in need all over this world. From remote villages to dense cities, from Eastern Africa to Central America to the Caribbean and Eastern Europe. Areas where children have very limited resources for life-saving healthcare. El Salvador is a shining example of where we see our success. In El Salvador, we have worked with the local government, with the hospital, with the healthcare professionals, and an on-the-ground NGO to ultimately develop one of the strongest self-sustaining programs in Central America. Ivan Lopez is the executive director of our affiliate in El Salvador, Latidos de Esperanza.
Our main focus always have been to give the opportunity to the Salvadorans to do the job that they already know how to do. They just need the resources to provide them supplies, equipment, train them. Without the partnership of Gift of Life, a lot of children wouldn't be alive.
Every month, Yvonne coordinates our nutritional program in El Salvador. And this is crucial to stay in touch with the children, to track their growth, to ensure that after surgery, these children have the proper nutrition to become healthy and strong as they get older.
Not only we have healed their hearts, but we have changed the life of their whole families.
Gift of Life could not be Gift of Life if it wasn't for Rotary. And the work that they have done and the leadership that they have shown in bringing attention to the need for a pediatric cardiac program. They have seen a vision, and they really have been the beacon of hope for many, many children. The program in Uganda gives us great pride. Not only was our first child ever from Uganda, but we now could show the great comparison of how we can now take care of children in Uganda without them having to travel to other countries. We are very fortunate to have Dr. Michael Okecho to be our partner in Uganda. He is an example of a young, vibrant doctor who really wants to give back to his community.
So Gift of Life helped to empower us to run the program on our own. And you're able to reach more patients. Being able to give a child back to their life, it's a tremendous privilege. It brings a sense of joy that you cannot measure.
When you're able to provide a program and give the resources to doctors and nurses that they can ultimately use their training to help their own children, it's a tremendous feeling for them to really believe that now they can do what they were trained to do. What has made our program in Romania successful is that the partners really have come to the table and produced. You have the city of Bucharest that has provided a world-class facility. The Ministry of Health of Romania that has allowed for state-of-the-art equipment to be put into that facility. And then you have the support of the local hospital to employ a team that now is able to operate and treat ultimately hundreds of children. There are times when certain parents grab your heart. Recently in Romania, I met a mom, Andrea, with a little girl, Jessica. And she, by herself, took her daughter to 3 different hospitals and pleaded for them to help her child. And the first 2, she was not successful. But the last one was during our training visit.
When she plays, the heart is beating very, very fast. I was very scared, and worried. I don't know what to do.
And the fact that you can help that mom realize the dream she had to bring care to her child, that's why you don't stop. That's why you keep on going to the next country and the next country. That's why you keep on asking people to help you, whether it is with their time or their money. Because at the end of the day, it gets down to be as simple as that. You can save a child's life if you have the resources to do so.
I am very thankful to the doctors that help us to make the children okay, to repair their hearts. This is a big chance to us.
While there are core countries that meet our guidelines, there are just certain countries that we cannot turn our back on. And probably some of the greatest work that we feel the most proud of is what we do in Haiti, because no other non-governmental organizations are in Haiti today providing open heart surgery and cardiac care to the children of that country. The director of the hospital in Haiti, Dr. Jacques-Claude Goutier, is truly one of the great advocates providing health care in a very, very difficult setting.
When I look around my country, providing health care for the population is a huge challenge. I can attest of the despair sometimes that I see on mothers' face, because oftentimes when they come here, they've gone to 3 or 4 places where access was denied. The partnership with Gift of Life is a success. Building the capacity of our institution in terms of equipment, in offering training for the staff. So without Gift of Life partnering with us in Haiti, thousands of children would die.
It's impressive that Gift of Life has ventured into Haiti through humanitarian efforts, knowing that there's such desperation for these children. I'm Dr. Gabe Owens. I'm an associate professor in pediatric cardiology at the University of Michigan Congenital Heart Center. Gift of Life has been tremendously impressive. They are the leaders in helping to develop sustainable programs. They identify the need, they identify the infrastructure that's needed, and they make it happen. I have been incredibly proud to work with a principled and dedicated organization such as Gift of Life. I couldn't ask for a better partnership to do this work.
A great part of this work is to see the children who have been treated through our program and now are flourishing and happy and enjoying their life. Being there when they get together to share important milestones is a tremendous feeling.
If I hadn't had my heart surgery, I would not be here today. The doctors had said I would not live beyond 16 years. I'm 48 now. So Gift of Life has been a central piece in my life.
We envision a world someday that will allow for a mom or a dad to look at their child and know that there is hope in the country where they live to be able to treat that child. We're proving that it can be done. And it can be done in every country. It's just a matter of having the resources, having the support, and really going out and just making it happen. Every parent in every country who desperately needs cardiac care for their child should be given the opportunity for treatment and feel that joy of walking away with a healthy child into a brighter future.
Makes you proud to be a Rotarian, doesn't it?
Yes.
Yeah.
Grace was here
Okay.
with Steve at the district conference.
Yeah, Grace was here at our district conference
Yeah.
2 years ago.
2 years ago.
And she's a great gal. I've become friends with her over the years, as you can imagine. Had her at my house. We had a big reception for her. That was a lot of fun. A few things. Gentleman, fellow Rotarian here in the Sarasota Southside Club, many of you probably know him, Lou Riccio, is also from that same area of Long Island, and he was instrumental in getting the program started down here. So and I bring him up because I'm going to tell you why in a second. He was very, very involved with El Salvador, who I'm going to use as an example quickly here. But those of us who were hands-on involved with the Gift of Life program when the kids were coming to our neighborhoods and our communities, we really, really miss that interchange and that interaction. Yeah. But let me tell you this. In 2008, prior to this Gift of Life International coming together, amongst all of us between 1975 and 2008, so that's 33 years, we were so happy when we reached 10,000 children who had been saved. Well, since 2008 to now, which is 13 years, the number is now 38,000 and counting. So in 13 years, we did over 28,000 kids working with this new model. And most importantly, we are getting them to do it in their own countries. You don't have the trauma of a plane trip. And I mean, almost every one of these people that would come over, it was their first time ever in an airplane. And that was just coming here. That, you know, again, this was happening all over the world. So it was a big deal, and we really miss what we're doing. But even so, our district has been so supportive. In the last 3 years, our district alone, between donations from clubs, donations from individuals, individual Rotarians, some not Rotarians, people who hear about us and give us money, and matching DDF, we have gotten involved with we've donated over $250,000 in the last 3 years to international grants around the world, which is how we now pay for these missions all around the world. In 2019, Rob personally goes on all the missions, was on 24 missions 1 year. Last year, this kind of surprised me, we did over 1,300 surgeries out of the country last year, despite COVID. We didn't have as many teaching opportunities, but we now have a number of programs like El Salvador. Let me just use that as an example, because again, Lou just did such a great job with that, getting that program going. When we first got started around 1997, 1998, they were doing about 5 open heart surgeries, pediatric open heart surgery a year. And they were losing like 2 out of the 5 kids. 2019, before the pandemic hit, that year alone, they did 240 kids on their own, with a mortality rate of less than 1%. So this is due in such large part to our district and the focus that we have placed on that one particular program. But we're also known as in District 6960, we call ourselves Gift of Life of Florida. We're known throughout the world because we just do such a great job. We've touched so many people's lives, and a wonderful program. And I want to just tell you a brief, I see I have a few minutes here, right? Just a brief story about how I got involved in this. It was in 1989, and I had just elected president of my club. And my district was right next door to the district that had originated this in 1975. All these years, we kind of looked at that district a little enviously and said, you know, we should be able to get something going in our district. So they had a big meeting of all the presidents, and I went to it, and they unveiled this tremendous program with Stony Brook University Hospital as our partner. And they said, now, who wants to support this cause? What club? And I think I scratched my head or something. And the guy that was running the meeting says, Steve from the Middle Island Club. Okay, thank you so much. So we were in. 2 days later, I get a call from this guy, a wonderful Rotary. He said, Steve, I'm so glad you're willing to support us. Tomorrow night, we have a young girl coming in from Korea. She's 8 years old and she needs to, her surgery's all lined up. We need a club and a host for her. I was married at the time. My 2 daughters were 5 and 4 years old, and we had a 3-bedroom house. I hadn't told my club about this yet. I hadn't told my wife about this yet. So, yeah. So I went to her and I said, look, I'm kind of in a jam. Fortunately, it's a little girl. I think she was about 8 years old. So she said, okay, well, we'll just put the 2 kids in one bedroom and she can have the other bedroom. I said, okay, good. I went to my club and they said, okay, we'll do it. So anyway, I go to pick up this young lady at Kennedy Airport. And she gets off the plane. It was pretty easy to see who she was because she was a little Korean young lady. And she had a hostess from the airline was with her. And I don't know if any of you remember, there used to be when you go to a stationery store to buy a gift card, not a gift card, a greeting card. And you get one of those little brown bags that they put the card in. She was carrying that. And I was thinking, what the heck is that? So I asked the lady from the airline, I said, what is that she's carrying? That's her luggage. Inside that bag, she had her night clothes. And the rest of the clothes that she was wearing was going to be the clothes that she was going to wear for the estimated month or so that she was going to be with us. It was in the summertime, and it wound up that she was with us the entire summer because she had some serious complications. And she had to have numerous surgeries. Her name was Kisu Kim. I'll never, ever forget her. So anyway, I have video at my house of my kids running around playing with her. And it was just an incredible experience. And I had been in Rotary at that point about 5 years. And I liked being in Rotary. It was a lot of fun. I got to meet all the important people in town. It was an evening meeting that we had at a country club. So there was always cocktails involved. And it was just a lot of fun. And we did some local things. But I had no clue what it was meant to be a Rotarian until that experience. And that happened to so many people through this program over and over and over again. And we kept in touch with Kisu for many, many years. You would call, of course, we never learned how to speak Korean, obviously. She didn't learn how to speak English, maybe 10 words. But she'd call up and say, hello, Merry Christmas, and we knew it was her, and it was just great. But I really realized how important this was. That was my beginning of getting involved. Once that happened, forget it. I was in hook, line, and sinker, a big part of my life ever since. About, I don't know, 13 or 14 years after that, my oldest daughter was applying to college. And my wife was taking care of all that stuff. I was busy working, and she was more in tune with college and stuff like that, having gone herself recently prior to that. And so she was in charge of getting her through the whole process. And one day at dinner, I just happened to say, so what's going on? It's getting close to college starting. You know, did you get accepted? Are you going or what? She had great grades. She had the finances for all. Everything was in place. I said, well, I got to write a composition about some paper. I got to turn a paper in. Once I do that, everything will be okay. So sure enough, she went to college. I never thought about it again. And she came home at Christmas time after her first semester. And we were sitting around the table again. And my wife said to her, listen, did you ever tell your dad about that composition that you wrote? And she said, no. She said, why don't you read it to him? So she said, oh, no, I don't want to read it to him. So she said, Dad, I'll give it to you. You can read it yourself. I said, okay. So I'm going to paraphrase here. Starts off by saying, when I was 5 years old, my father taught me what it meant to help someone in need. When we invited Ki-suk Kim to our home for open heart surgery. And I never realized, all those years had passed, and I never realized the impact that had on my children. My younger daughter too is very, they're adults now, and they're very, very generous people. And that definitely had an impact on them. So here's what I thought the question I always like to pose. Who was the winner here? Ki-suk Kim got a new lease on life. God bless her. I hope she's still with us today. I would imagine she is. My daughters got an education that I would have been willing to pay anything for, to teach them that particular life lesson. What would you pay to teach that life lesson to somebody then? And it came to me for 2 reasons. Number one, because of Rotary and the opportunities that Rotary provides. And number two, because all I did was say yes. So that's the message that I try to spread to all my Rotary friends. Take advantage of this organization. Take advantage of the different programs. Find something that you have a passion for and say yes. And it'll impact your life many, many more times. And it continues to impact my life today. So with that, I want to thank you all for your kind attention. Thank all of you on Zoom. It's wonderful to see you all.
Thank you. Have any questions for Steve before
What does it cost today, Steve? Per child, does
It depends on the country, but they're averaging about $2,500 or less per child. So their costs are a lot different than.
Are any of the hospitals that were involved coming back into the program around here? Like I remember when we had a Gifted Life Child, our club did, it was with the All Children's Hospital.
Yes.
And, but then when Johns Hopkins took over, then it, no more.
There were some whispers a year or two ago that Joe DiMaggio was thinking of getting back involved again. And we had some conversations with them. And then, of course, COVID hit. So maybe if we get to a point where we get beyond all of this other stuff. There still are some places in the US where they are taking kids from foreign countries who are really extreme cases. And they just feel that the program in that country is unable to. We still have some little pockets around the country.
And is this with COVID? I mean, they kind of put the kibosh on all elective surgeries and whatnot. How has that affected the whole landscape of it?
It's all on the hold, pretty much, like everything else.
Yeah, right.
So, okay, thank you again.
Well,
Appreciate you.
Steve, before you run away, we'd like to present you with a certificate in appreciation for your attendance and helping us with the presentation today and for Polio Plus. So we'll
Thank
make a
you.
donation in your name.
Thank
Thank
you
you for
very much.
coming. Absolutely. That was very touching, that's for sure. And again, everybody has their own why in Rotary, and it's different for all of us. And you just got to find what speaks to you and make it happen. And if we're not doing it, let us know. I mean, we still, to that point, we still have a couple of openings for speakers. So if you have something that is of interest and you haven't heard it yet, let us know and we'll reach out and see if we can line up those speakers on those topics. All right. Well, we don't have any birthdays or anniversaries. Do we have any happy dollars? Sad dollars? Anybody? Aaron's got one.
I'm always happy to, in the presence of Steve Agius, to hear him speak about his passion, whether that be wheelchair or.
Absolutely. Two wonderful programs that we have. And actually, Blaze, he was one of the ones when I reached out to you and asked you about the wheelchairs earlier this year. Blaze was inquiring, he wants to get on a list for when they open that back up. And he did the polio drops trip with JJ. Now he wants to do that one because that's special. Yeah. So, yeah, it's interesting how things just kind of come full circle. Anybody else? Anybody online have any happy dollars, sad dollars, anything you want to share? What'd you do now? All right. So doesn't sound like it. I wanted to also share with you, if you haven't seen it or haven't done it, Brenda has put together this Rocket Out program through Brookdale Rotunda. And it's a virtual, yeah. She almost looks like she's in the chair too.
Rocket, run your rocket.
Yeah, it's a virtual event. It will benefit our club and it will also benefit Meals on Wheels. It's on the 26th, and what she has is you can jump in and out of this Zoom call, and she's going to have some fun activities. And I also understand that Kim Parks might be rocking out from the corner of 776, so you might want to get some photo ops there. But it'd be a lot of fun. Just raise a little bit of money. It's not expensive. She's asking for a $10 registration or a donation. If you can do that, if not, jump in on the Zoom and join in the fun. Again, we're kind of limited on our fundraising, what we can do this year. So this was a way that, she was challenged by Brookdale to come up with something to replace her health fair that she usually does. So she kind of spun off in this direction, and we're grateful that she came up with the idea and included us in it. So anybody who hasn't done it, I have a couple here for you, Brenda.
Okay, cool. And I had,
anybody else have any other announcements?
wait, I want to
share.
Can I talk? Hello. Hello.
Yes.
Hey, I just want to give a shout out to Julia because I did get a call from Stone Environmental, I believe, that she wanted the link to donate to. So, and I mean, we have it. we've got almost $200 so far, but I've
Broke up
committed
on it. I
for
don't think it's
others-
on our end.
for others that haven't received it yet.
Yeah.
But, you know, it doesn't take a lot. It just needs some more push on it, you guys.
I have promoted to my staff. They can wear
Absolutely.
and rock
So
out on
I'm
that.
gonna encourage everybody to join in.
Deb, you have a delay on your end.
Yeah.
Yeah.
I would also suggest
Okay.
if you guys can put it on Facebook, if you are in any of the Inglewood groups. I have it on DACDB. I have it on the social media sites, and I've also put it on a couple of the Zone Rotary sites. So I would suggest share on social media as well.
I have it on mine. It's on our club's site as well as the website. So yeah, reach out and share it and, you know, see if anybody wants to get involved. Jennifer had something.
If you haven't heard yet, the county has canceled all proms for all high schools in the county. There's a bunch of us parents, senior parents, that are putting a prom together for the seniors. So it is gonna be a Lemon Bay High School is gonna be a plantation. We're finalizing the menu and stuff this week, but we are asking if anybody in the community has any or anything they would like to contribute to this, just because it is really coming out of the pockets of all the parents right now. If for some reason there's extra money, at the end, it's all gonna go to project graduation. It is really sad that so
Yeah.
I said, you can't tell the footloose generation you can't have a prom.
There you go.
We will find a way to have a prom.
That's right.
Are you strictly for monetary?
At this point, pretty much,
They got looking for sponsorship.
There-
That's what my phone.
yeah, next week, I'll
Okay.
have more information next week, because we just literally Saturday decided to plan.
Certainly, there's a possibility, depending on the level.
Right.
The club could take it a little. I think
Yeah,
that would
because
be-
the one problem is not considered like a 501c, you know,
Mhm.
not, so I know a lot of places only will give to those type of.
Absolutely.
So, it is really, we're trying to actually make it so it costs less than what it would have been done through the school.
Right.
Because there's normally it's about $75 a ticket, for prom, we're trying to keep the cost. Because of a lot of the jobs right now.
Right. Right. Well, and that goes back to the fact that, you know, I mean, this has changed everything in all
Right.
facets of life. I mean, we're starting to do some things, but you know, life is still not what it was, and it probably never will be quite what it was.
No.
Yeah. I mean, we don't know what that's gonna look like, you know, 6 months, year, 2 years from now. But you know, all we can do is adapt and try to help where we can.
I said, there was something. Yeah, we could use the problem.
Yeah.
We talked about doing, outdoor venue, like, but part of that was having to bring in napkins. Bring the nice bicycles, are gonna be all dressed up.
And Right. washing
stations.
Yeah. Yeah.
With everything else. You're at a,
Absolutely.
because I thought that would be awesome.
Well, if you can get me the sponsorship information, I will share it through the club and we'll talk about it at the board meeting this evening. I'll add it to the agenda. Fair enough. Anything else from anybody? We have the 50-50. I don't know what we got there. All
A
right,
glass of wine.
there you go. All right,
Here.
That's 4, 6, 5, 3.
Me. Here.
You
You got a glass of wine? Yeah.
But you need 7 straws.
thank you. Oh, okay. Thank you. All right, anything else that anybody has that they want to share? Can we call
Speaking
it?
of the card bucket.
Yes.
It's really easy to do that online.
It is.
So.
I have set mine up to be
That's
reoccurring,
right.
so
set
I don't
mine
have to think about it anymore. I just know it's going there.
It's great. You can
Yeah,
do it
I'll
reoccurring.
reshare that. It was on my emails earlier in the year. And it's a digital link. You can go in and sign up, and it's like my Rotary where you can set up your donations there as well. But you can schedule it. Whatever dollar amount you want, however often you want, and
Whatever account you want to add.
yeah, it's
Yeah,
very
there's
easy.
A lot of the clubs in our district really support this.
Yes.
You know, it's amazing, the money that goes.
Absolutely.
Kind of
It's worth it to send out another reminder.
Yeah, I'll include it in my, yeah, yeah. So speaking of the blue buckets, and you know, we all know today is Mardi Gras, so I just brought a few things. If you're interested in celebrating, please take the little trinkets home. It's just some beads and some masks. Thought it was kind of fun. So I think that is all that we have for today. Anybody online have anything that they want to add? All right, awesome. Thank you for joining us, Yano. It was good to see you. You're welcome anytime to join us.
Stay warm.
All right.
Yeah.
Buzz, would you like to lead us out as well with four-way test?
Hello?
Yeah.
Four-way test on the things we think, say, or do. Number one.
Is it the
truth?
truth?
The truth. Number two.
Is it fair to
Fair
all
to all
concerned?
concerned. Number three.
Will build goodwill and better
Their
friendships.
friendships
Will be
will be
beneficial
beneficial
to all
concerned.
Thank you, everybody. Have a great afternoon.
Here's a happy hour. Never used.
I'll get it. Yeah, thank you.
So much.
Thank you for coming. It's good to see you, especially in person.
Stay warm,
You know,
Yano.
we have some.
Will do.
Always.
I've done a couple of Zoom ones.